The ROX Flow Procedure is a minimally invasive method to create a connection or an anastomosis between the iliac artery and the iliac vein using the ROX coupler. The procedure is performed percutaneously and can be done in an angiography suite, endovascular operating room, or a hybrid room using only local anesthesia. Fluoroscopic imaging is used to guide the procedure for placing the ROX coupler to form the anastomosis. To begin the procedure, a 4 French sheath is placed into the femoral artery access site. The 11 French ROX controller sheath is placed into the iliac vein. The ROX controller sheath provides venous access and support for the crossing needle and the ROX coupler delivery system. The ROX crosshair coiled guide wire is introduced through the 4 French arterial sheath and deployed near the location for the coupler placement in the iliac artery. The crosshair wire serves as a target for vessel crossing from the iliac vein to the iliac artery using a small crossing needle. The crossing needle is introduced through the 11 French venous sheath to the desired coupler placement location in the vein. The crossing needle is advanced through the iliac vein and artery walls into the adjacent artery. A guide wire is advanced through the crossing needle and into the iliac artery. While maintaining the guide wire position in the artery, the crossing needle is retracted and removed. The 11 French ROX controller sheath is then advanced to the crossing site location to support the delivery system introduction. The ROX crosshair wire is then removed from the iliac artery. The unique flexible tip of the ROX delivery system aids in the crossing and safe positioning at the desired crossing location. The delivery system is introduced over the guide wire through the 11 French venous sheath, through the vessel crossing point, and into the iliac artery. With the delivery system appropriately aligned in the iliac artery, the locking pin is pushed to the left, allowing the thumb slide to be moved back to the first stop position to deploy the arterial side arms of the ROX coupler. In the second stage of the deployment of the ROX coupler, the locking pin is moved to the right, allowing the thumb slide to be moved back to the full deployment position, releasing the venous side arms of the ROX coupler. This forms the initial part of the anastomosis between the external iliac artery and the vein. The delivery system is removed while maintaining the position. A 4 mm balloon is placed over the wire through the 11 French venous sheath. The balloon is positioned in the coupler and inflated to size the final 4 mm calibrated anastomosis. The pre-coupler arterial blood pressure may be observed while the balloon is inflated, and the post-coupler arterial blood pressure may show a confirmatory drop upon balloon deflation and creation of the anastomosis. After the balloon dilation is completed, an arterial angiogram is performed to confirm the coupler placement and the patency of the anastomosis. That completes the ROX Flow procedure.